Welcome to EMTprep Pulse Check, the podcast where we help you sharpen your knowledge, ace your exams, and stay field ready. Whether you're prepping for the NREMT or looking to stay sharp in the ever-evolving world of EMS, we've got you covered. Each episode brings educational insights, real-world case reviews, and expert tips to boost your confidence, both in the classroom and on the call. Let's jump in.
Today we're focusing on bloodborne pathogens. Let's get started with a lecture brought to you by Jenna, one of our content creators. Then we'll wrap up with a few multiple choice questions for review. Hey everyone, welcome to today's lecture on bloodborne pathogens. So today we're going to be talking about bloodborne pathogens because in EMS, these are things that we have the potential to encounter. And really anywhere that you work in the healthcare field, you're most likely going to be mandatory to take a bloodborne pathogens course. So most of you listening have probably done a similar course to this in the past when you started a new job. But these are things that are good to be aware of because they are things that we will come into contact with. And the more we know about them, how they're spread, how we protect ourselves, the better off we're going to be. So let's start by defining what is a bloodborne pathogen. So OSHA gives us the definition for what a bloodborne pathogen is, and they define it as pathogenic microorganisms that are present in human blood and can cause disease in humans, right? Pretty straightforward. It's organisms that we find in our blood, and blood for this purpose includes any components of blood, so plasma, platelets, etc., or any products made from blood. So these are organisms that we find in blood of some sort that have the potential to cause disease and harm in humans. There's also a few other potentially infectious materials that bloodborne pathogens can be transmitted through, and that includes semen, vaginal secretions, cerebral spinal fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva, any tissue or organs from a human, and then also cells or cultures from animals that are infected with a bloodborne pathogen. So blood is the main one that we think of, hence the bloodborne pathogen, but there are other ways that these diseases can be transmitted. So today's course is going to cover a few specific exposures for bloodborne pathogens. We're going to talk about HIV, HBV, HCV, malaria, brucellosis, syphilis, and West Nile virus. So starting with HIV, which stands for human immunodeficiency virus, and the way that HIV works is it destroys cells of the immune system that are responsible for combating disease and infection. So our body has a natural compensatory mechanism that when disease and infection try to come in, we have ways that we fight that off. The problem is if we are infected with HIV, those cells get destroyed. If HIV progresses, if it's untreated, or if the treatment is just ineffective, HIV can turn into AIDS, which stands for Acquired Immune Deficiency Syndrome, which results in virtually the complete destruction of the immune system, which means any patient that has AIDS basically has no immune system, and they're super vulnerable to opportunistic infections. So the things that you and I could probably fight off or never get sick with in the first place are going to affect those patients a lot more and have significant impact. So HIV is contracted through exposures to either infected blood or other bodily fluids like semen, vaginal fluid, rectal fluid, and breast milk. And exposure to these fluids can occur through a few different ways, including needle sticks. So especially in the context of sharing needles, people that maybe use drugs or are sharing needles for some purpose, HIV's super easily spread in that form. Can be spread through vaginal or anal sexual contact or the sharing of breast milk. It is important to note that HIV is not spread through saliva, sweat, tears, touching intact skin, toilet seats, mosquito bites, etc. Then we have hepatitis B, or more commonly known as HBV. So hepatitis is inflammation of the liver. So this illness results in either liver damage or cirrhosis, which is that scarring of tissue. And in severe cases, it can result in cancer. The nice part about hepatitis B is there is a vaccine. So if you get that vaccine, which most people do, you are much more protected against contracting HPV. It is spread through blood, semen, and/or vaginal secretions. If someone does get infected with HPV, there's a variety of symptoms that they can experience, including but not limited to fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored stool, joint pain, or even jaundice in some cases. Typically, we see about a 60 to 150 day incubation period for these symptoms to occur. And once these symptoms do occur, they can last for a few weeks up to 6 months if that patient has an acute infection. It's also possible that patients develop a chronic infection as a result of HBV. This is more commonly seen in patients that are immunocompromised or in infants who develop the infection before or upon birth, which makes sense, right? We think about immunocompromised and infants in general just don't have the immune system to fight off these diseases. So if a healthy young adult comes into contact with HBV, they may get an acute infection and not feel well for a couple weeks, but for the most part, they have mechanisms to fight it off and fare better. Whereas our immunocompromised population and our infants just don't have that ability. So their risk for developing a chronic infection is much, much higher. Next, we have hepatitis C, or HCV. This one is a little more problematic because it more often develops into a chronic infection versus HBV, like we were just talking about. It's much more common that we see HCV turn into a chronic infection. Similar to HBV, though, it does cause liver disease. It causes liver cirrhosis, and it also can result in cancer in some cases. Unfortunately, there is no vaccine for HCV. So that's another differentiating factor between the two, is there's no vaccine for hepatitis C. Although the FDA does have an approved treatment that has been known to cure the infection in 8 to 12 weeks. So although we don't have the ability to prevent the disease, we do have treatments that are available if it is contracted. Symptoms of hepatitis C are kind of interesting because a lot of times patients may not be symptomatic until they get into the advanced stages of the disease. So like I was saying, it is more often turning into a chronic infection. And patients that have chronic infections may be asymptomatic for 10 to 20 years. So the exposure could have been a decade or two before. They didn't even know they were exposed. And then 10 to 20 years later, now they're symptomatic, but they're already in the advanced stages of the disease. HCV, hepatitis C, is the primary cause of a liver transplant. Transmission for hepatitis C is exclusively through blood-to-blood contact. So unlike some of the other ones that can be transmitted through other bodily fluids, this is blood-to-blood contact strictly. Then we have malaria. So malaria is caused by Plasmodium parasite and is a mosquito-borne illness. The nice part is it is both preventable and curable, with the best way being what's known as vector control, which is controlling the mosquito population. That's the best and most effective way to control the spread of the illness. If we can control how many mosquitoes are around, then less patients are going to be bit by mosquitoes and therefore less likely to get the disease. Symptoms of malaria include fever, chills, kind of flu-like symptoms, or also known as acute febrile illness. Next, we have brucellosis, and this is an illness that's acquired from contact with infected animals or their meat. So this can be from eating undercooked or unpasteurized meats and dairy products that are infected. Those that work in slaughterhouses or in labs are susceptible to breathing that bacteria in and acquiring the infection. So this is one of those things that we don't think about often when we're eating undercooked meat or those sort of things, but this is something to be aware of that is out there that you can be exposed to. Person-to-person transmission is rare because, again, it's the contact with the infected animal or their meat products. But one little side note is that it can be passed through breast milk. So if a mother has contact with an infected animal or, she consumes dairy products that were infected, she can pass it down to her child through breast milk. Symptoms for this disease include fever, sweats, just general malaise, anorexia, headaches, fatigue, pain in the muscles, joints, and the back. Prognosis-wise, this disease rarely results in death, although it may take weeks or months to treat. So it is kind of a long haul. Patients experience symptoms for quite a while, and it also comes with a variety of long-term symptoms that can include recurrent fevers, arthritis, testicular or scrotum swelling, endocarditis, neurological symptoms, chronic fatigue, depression, liver, or even spleen swelling. So although it rarely results in fatalities, there is a lot of negative long-term effects that can come with this disease that can be very detrimental to patients. Next, we have syphilis. So syphilis is most commonly a sexually transmitted disease, and it's spread through contact with painless sores on the genitals, rectum, or the mouth. The other way it can be transmitted is from mother to unborn baby. So it's something that actually all expecting mothers get tested for this reason. So doctors can be aware of what the risk of passing it from mother to baby is. Syphilis can remain dormant for years following the initial infection. So again, patients may have an exposure and be carrying the disease and not even know it. If the infection is caught early, it can be treated and cured oftentimes with antibiotics. But if it's left untreated, it can result in damage to the heart, brain, other vital organs, and ultimately can result in death. So there's a few components to the disease progression. The first one being the primary infection. So the primary infection is that painless sore at the site of infection. The secondary infection can include a rash on either the trunk or possibly the hands and the feet. Can result in wart-like sores in the mouth or on the genitals. Can result in possible hair loss, muscle aches, fever, swollen lymph nodes. And those symptoms can kind of come and go for up to a year. Then you have a latent infection. And so the disease may go dormant and never return, or it may remain dormant for years before returning. Then we have tertiary. So about 15 to 30% of infections, if left untreated, may progress to this stage. And this is where we start to get into damage to the brain, the nerves, eyes, the heart, blood vessels, liver, bones, and joint damage. So that's when it gets a little more serious, can be harder to treat, and have worsening effects. So the final one we're going to cover is the West Nile virus. This is also a mosquito-borne illness like malaria, and many of these infections remain asymptomatic. It's estimated that only 1 in 5 individuals will develop mild symptoms such as fever, headache, body aches, joint pain, vomiting, diarrhea, rash, or fatigue. And there's an estimated 1 in 150 people develop serious or possibly fatal illnesses. And when we talk about the more serious symptoms, this can include high fever, headache, stiff neck, disorientation, coma, convulsions, muscle weakness, vision loss, numbness, and even paralysis. Patients older than 60 years of age or patients that are immunocompromised or have other comorbidities are at a greater risk of developing the more serious illnesses and experiencing more severe symptoms. Typically, we treat the West Nile virus with over-the-counter medication for the less severe. And if a patient does develop the more severe cases, it oftentimes is going to result in hospitalization for these patients. So now that we talked about some specific bloodborne pathogens, let's talk about some general requirements that OSHA gives us. One of those is the appropriate PPE. And this can be different for different scenarios, different situations. But in general, that's going to include a combination of gowns, goggles, glasses, mask, face shield, gloves, respirators, etc. Really, the specific PPE is going to be required by your agency, your employer, local laws. They're the ones that give us specific requirements for specific situations. OSHA also says that we must comply with universal precautions. And this is what pertains to blood or any bodily fluid that contains blood. So that includes semen, vaginal fluid, etc. And OSHA's goal is to prevent parenteral, mucous membrane, and non-intact skin exposures of healthcare workers to blood-borne pathogens. Contamination is defined as presence or reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. So we either know for a fact that there was presence of blood or infectious material, or we can reasonably anticipate there's a high likelihood of this exposure. Oftentimes we think of contaminated objects that include laundry. Sharps is a huge one, especially for us as EMS providers, laboratories, procedure surfaces, etc. So then we have to decontaminate, right? And this is a topic that we discuss in EMS for different patients that may require decontamination. It's often talked about in the hazmat world, but this is important in the bloodborne pathogen world as well, because decontamination involves use of physical or chemical means to remove, inactivate, or destroy bloodborne pathogens on a surface or item to the point where they are no longer capable of transmitting infectious particles, and the surface or item is rendered safe for handling, use, or disposal. So how can we either remove the infectious material, how can we make it inactive, or destroy it so that there's no longer the risk of it causing harm to the surface it was exposed to? OSHA defines exposure as when the eye, mouth, other mucous membrane, non-intact skin, contact with blood, or other potentially infectious materials that result from the performance of an employee's duties. So an employee was performing an act, they were performing a duty, and now they came into contact with this blood or other infectious materials. So what do you do if you do have an exposure? OSHA says that if there is an exposure, the employer must provide confidential evaluation and follow-up available. So if you get an exposure at work, you have the right to full evaluation and follow-up. And OSHA actually also says that there must be no cost to the employee. But there's a huge importance on immediate reporting. So the minute there is an exposure, when it is safe to do so, obviously you can't, stop the call and report it then. But the minute you have the moment to do so, you must immediately report it to your employer. And the source of the exposure must be identified. The source must be tested if it's feasible to do so, legal and available, and those results may be shared with the exposed worker. So if there is a needle stick at work, then the patient that we were using the needle on may be required to do some extra testing to see if there is presence of a potentially infectious bloodborne pathogen, and those results may be shared with the exposed worker. But really the importance is knowing what your reporting process looks like for your employer or your agency or your department. What does it look like? If you have an exposure at work, who do you report it to? What does the follow-up process look like, etc. So on top of immediately reporting it, there's also things that need to be done immediately following the exposure. If it is a needle stick or a cut that somebody else's blood maybe came into contact with, any needle sticks or cuts should be washed thoroughly with soap and water. Nose, mouth, skin that has been splashed should be flushed with water. And then if something happened to your eyes and you had an ocular exposure, that should be irrigated with clean water, saline, or sterile water. So OSHA does have requirements for developing what is known as an exposure control plan. And this includes determining employee exposure and job classification. So as an employee, you have a job classification, and listed in there is what you could potentially be exposed to. The exposure control plan must also include the implementation of various methods of exposure control. So what steps are we taking, or is your employer taking, to prevent exposures from happening? It includes a hepatitis B vaccination, post-exposure evaluation and follow-up, and then communication of hazards to employees and also proper training, right? It doesn't do any good to have this plan in place if nobody knows what it entails. So you have to have a plan in place, and all of your employees must know what that plan entails. Also includes record keeping, which may include procedures for evaluating circumstances surrounding exposure incidences. And so these exposure control plans are established by individual agencies or establishments. So although they can be unique to a given location, the above elements should be included and defined in each plan. So this kind of gives the rough layout of, hey, this is what your exposure control plan has to contain. But every job, every workplace, it's going to be a little bit different. There's no one size fits all for an exposure control plan. But those are just the general guidelines of here's what they must include. So there's a general foundation. Now we're going to talk about one of the parts of the exposure control plan was the methods of exposure control. And that can include a bunch of different things. It can include engineering controls, which is reduce exposure in the workplace. So the goal is to isolate or remove the hazard or isolate worker from the hazard if at all possible. So this can include self-sheathing needles, right? So when you pull a needle out, it automatically caps it for you. This can include puncture-resistant sharps containers, ventilation devices and barriers, etc. With those goals being, we're trying to remove the potential hazard before it even becomes a thing. If your needle automatically caps itself, then the risk of a needle stick goes down significantly because there's not a open sharps to be stuck with. There's also work practices, right? These are behaviors that reduce the risk of exposure. This can include not eating, drinking, or touching mucous membranes while environments that are at risk for contamination or exposure. In general, we probably shouldn't be eating anything in the back of an ambulance because it's disgusting back there. That's a full environment of things that could potentially be infectious. There's always a risk for contamination, etc. We want to wash hands properly, right? Rinsing all surfaces with clean, warm water, using soap and scrubbing all the surfaces of your hands for at least 20 seconds, and then rinsing soap off with warm water. We want to use all equipment according to manufacturer guidelines. Dispose of sharps in designated sharps containers immediately following use. So we are not doing the old school, taking the sharps out and sticking it in the seat cushion of the ambulance. The minute you are done using a needle, it goes in a designated sharps container. And really taking extreme caution when using or disposing of equipment that's contaminated or possibly contaminated with bloodborne pathogens. Some of that is provider self-responsibility, right? If you know that your patient has a potential bloodborne pathogen, taking those extra steps to protect yourself and your crew from that exposure. One of the other things that we can do to help eliminate or prevent bloodborne pathogen exposures is just general housekeeping, right? Regular cleaning, disinfecting of our equipment, of our ambulances, of our stations can help reduce the exposures to bloodborne pathogens. This includes cleaning and disinfecting after procedures, spills, and between shifts, or especially if you have a call where, again, there's a suspected or confirmed bloodborne pathogen, taking that extra time to disinfect the ambulance, the gurney, etc. Make sure that when you are cleaning and disinfecting that you're wearing proper PPE and then properly disposing of infected or possibly infected materials. And then follow your agency's rules on disposal of sharps, broken glass, and any other contaminated equipment. So like I mentioned at the beginning of this presentation, bloodborne pathogens is an annual training that's required for individuals that are at risk for exposure to bloodborne pathogens or other potentially infectious materials while in the workplace. So this includes healthcare workers, emergency responders, but it also includes school and daycare staff, cleaning and janitorial staff, tattoo artists, permanent makeup artists, anyone that's coming into contact with bloodborne pathogens are required to take an annual training on this topic. And OSHA lays out some pretty specific required topics for bloodborne pathogen training. That includes an accessible copy of the regulatory text of this standard and an explanation of its contents, a general explanation of the epidemiology and symptoms of bloodborne diseases, an explanation of the modes of transmission of bloodborne pathogens, an explanation of the employer's exposure control plan and the means by which the employee can obtain a copy of the written plan. Training must include an explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood and other potentially infectious materials. It has to have an explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering controls, work practices, and personal protective equipment. Information on the types, proper use, location, removal, handling, decontamination, and disposal of PPE. Annual bloodborne pathogen training must include an explanation of the basis for selection of PPE, information on the hepatitis B vaccine, information on the appropriate actions to take and who to contact in an emergency involving blood or other infectious materials. Also must include an explanation of the procedure to follow if an exposure does occur, including the method of reporting the incident and the medical follow-up that will be made available. Must include information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee. An explanation of the signs and labels or color coding required, and an opportunity for interactive questions and answers with the person conducting the training session. So for all those times that you've sat through bloodborne pathogen training, you probably didn't sit down and think about all the things that it included, but OSHA does lay out very specifically all of those requirements that your bloodborne pathogen training must include. Because the reality is, especially in healthcare, we have huge potential to be exposed to bloodborne pathogens. And so knowing how we can protect ourselves, protect our patients, our crew, where those exposures are most likely to happen, what to do if we are exposed, and how to handle that is crucial to the longevity of our career. And so I encourage you that next time you have to sit through a bloodborne pathogen training, to listen to your agency's policies and procedures, be familiar with them, and really focus on your scene safety and your safety, the steps that you take to protect yourself from exposure to bloodborne pathogens. And thank you for tuning in to today's course.
Now let's transition into some multiple choice questions.
First question. When treating a patient with hepatitis, it is especially important to options include wear a HEPA or N95 respirator mask, warn bystanders that the patient has the disease, have the patient wash or disinfect their hands frequently, or ensure that no direct contact is made with the patient's blood or other fluids without adequate PPE. The correct answer is ensure that no direct contact is made with the patient's blood or other fluids without adequate PPE. Hepatitis is communicable through some bodily fluids, so avoiding contact with the patient's fluids becomes especially important. A mask is not necessary because hepatitis is not caused by an airborne pathogen. For privacy and legal purposes, you should never tell bystanders about the disease or condition of a patient. Next question. Which of the following infectious diseases is not spread by contact with infected blood? Options include hepatitis A, HIV, hepatitis C, or hepatitis B. The correct answer is hepatitis A. Hepatitis A is transmitted by contact with infected feces. Hand washing is extremely important in stopping the spread of hepatitis A, but a vaccine is also available. You are transporting a 29-year-old female for abdominal pain. During your patient interview and history gathering, you learn that the patient is HIV positive. All of the following bodily fluids are capable of transmitting HIV except options include sputum, cervical secretions, vaginal secretions, or blood. The correct answer is sputum. HIV is transmitted by contact with blood, semen, and vaginal or cervical secretions. However, these fluids have to make contact with mucous membranes or open wounds. The fluids can also transmit via vaginal or anal sex as well as the placenta to the fetus. Next question. Healthcare providers are most at risk for developing which kind of hepatitis? Options include B, D, C, or A. The correct answer is hepatitis B. Hepatitis B can be transmitted by contact with any bodily fluid, although blood is the most likely bodily fluid to cause transmission. Next question. When dealing with large amounts of blood, it is important to do what? Wear PPE and follow the proper cleanup procedures. Let the victim treat their injuries without your contact. Not touch the patient in order to keep from being infected. Or make sure paramedics clean up the blood. The correct answer is wear PPE and follow the proper cleanup procedures. Your job is to treat the patient, which involves touching them. It is imperative that you don the proper PPE before coming into contact with the patient and follow the proper cleanup procedures. Next question. You came into contact with bodily fluids while administering first aid. How should you dispose of the soiled gloves and materials? Options include in any type of trash can that has a bag, in a blue biohazard bag at the hospital, in a clear plastic bag, or in a red biohazard waste bin. The correct answer is in a red biohazard waste bin. After treating a patient, it is extremely important to dispose of soiled dressings and gloves in the proper receptacle to prevent the spread of bloodborne pathogens. They should be placed in a red biohazard container. Next question. Which of the following type of hepatitis is not spread through blood and sexual contact? Options include hepatitis B, hepatitis A, hepatitis C, or hepatitis D. The correct answer is hepatitis A. Hepatitis A is spread through the oral ingestion of fecal material. The other three are spread through blood and sexual contact. Hepatitis B can also be spread through saliva, urine, and breast milk. Next question. What is used to protect both rescuers and patients from disease? Options include personal protective equipment, or PPE, gauze bandages, distance and time, or emergency medical services? The correct answer is personal protective equipment. PPE is used to protect patients and rescuers from the spread of disease and should always be used when interacting with a patient. This includes gloves, masks, eyewear, and in some cases, gowns. Next question. In order to acquire hepatitis D, a person must already have which kind of hepatitis? Options include hepatitis B, hepatitis E, hepatitis C, or hepatitis A. The correct answer is hepatitis B. In order to replicate, hepatitis D requires hepatitis B. Last question. Which of the following diseases is not a bloodborne pathogen? Possible answers include Lyme disease, herpes, HIV, or influenza. The correct answer is influenza. Influenza is spread through the air via drops or particles from the infected person.
Thanks for tuning in to EMTprep Pulse Check. If you found today's episode helpful, be sure to subscribe, leave a review, and share it with your classmates and crew. For more test prep tools, study guides, and practice exams, head over to emtprep.com. Until next time, stay sharp, stay safe, and stay on pulse.